Xin chào mừng tất cả quý anh chị hội viên đang tham dự hội thảo trực tuyến được tổ chức bởi Chi hội Thú y Thú nhỏ Việt Nam và công ty Royal Canin Việt Nam. Đây là chuỗi hội thảo bao gồm nhiều chuyên đề được tổ chức trực tuyến trong năm 2023. Quý anh chị vui lòng theo dõi thông tin trên website của hội hoặc là hộp thư điện tử để không bỏ lỡ bất kỳ một chủ đề nào trong cái chuỗi hội thảo này. Và sau buổi hội thảo đầu tiên là về chủ đề các bệnh lý tiêu hóa trên mèo, đã có rất là nhiều câu hỏi đến từ các anh chị về các vấn đề dinh dưỡng trên đường tiêu hóa và đặc biệt là dinh dưỡng khi chó mèo nhiễm các bệnh virus đường ruột như là PARVOVIRUS. Và như đã hẹn, hôm nay với buổi hội thảo thứ hai trình bày chủ đề bệnh do PARVOVIRUS trên mèo với sự trình bày của tiến sĩ bác sĩ thú y Emmanuel Fontaine đến từ công ty Royal Canin Americans. Và buổi hội thảo hôm nay chúng ta sẽ có phụ đề bằng tiếng Việt. Và tiếp theo xin mời thạc sĩ bác sĩ Nam An đến từ công ty Royal Canin Việt Nam giới thiệu đôi nét về speaker của chúng ta ngày hôm nay ạ.
Dạ, em xin cảm ơn chị Trúc. Em xin chào tất cả quý anh chị bác sĩ đang có mặt trong cái buổi hội thảo ngày hôm nay. Thì em xin tự giới thiệu, em tên là An. Thì hiện tại em đang làm quản lý truyền thông khoa học của Royal Canin ở Việt Nam. Thì diễn giả của chúng ta ngày hôm nay đó là bác sĩ Emmanuel Fontaine. Thì ông là một bác sĩ thú y có chứng chỉ diplomate về chuyên ngành sinh sản trên thú cưng, và ông đã từng là giáo viên ở trường đại học Oxford ở Pháp, và ông cũng đã từng đi giảng dạy ở rất là nhiều nước trên thế giới. Thì Emmanuel là một diễn giả rất là nổi tiếng về sinh sản và sinh lý cho thú non, thú sơ sinh. Thì ông đã từng làm việc với Royal Canin và hiện tại ông đang công tác ở Canada trong vòng 12 năm qua. Và không để quý anh chị chờ lâu nữa thì bây giờ chúng ta sẽ bắt đầu với cái buổi hội thảo ngày hôm nay về chủ đề parvovirus trên chó mèo. Vera. Buổi hội thảo sẽ có subtitle, sẽ có phụ đề bằng tiếng Việt, cho nên anh chị mình có thể theo dõi trên màn hình giúp em nhé.
Imagine being a new dog owner, delighted with a young, energetic puppy that suddenly falls severely ill. One day they're lively and active. The next, they're lethargic, refusing to eat, and showing clinical signs of a severe gastrointestinal disease. This is the stark reality of canine parvovirus infection, a disease we are all well too familiar with in veterinary medicine. It typically affects young dogs globally, and it is one of the leading causes of morbidity and mortality in puppies. The canine parvovirus is a single-stranded DNA virus. It affects rapidly dividing cells of the gastrointestinal tract, bone marrow, lymphoid tissue, and cardiac myocytes. And although its origin kind of remains a mystery, the virus shares a striking 98% of structural homology with the feline panleukopenia virus, suggesting an evolutionary jump from cats to dogs. Wild mammals may have also played a role in the virus's evolution, contributing to the advent of its various strains. And this is something I want you guys to remember right from the get-go. There is not one, but several canine parvoviruses, actually. The Minic virus, also known as CPV1, was first identified in the late 60s, causing both gastrointestinal and respiratory infections in dogs. In veterinary textbooks, it is still described as a cause of infertility and neonatal mortality in canines. Although I must admit, this is very uncommon these days, in my experience at least. And a decade later, a mutation led to the emergence of a distinct variant, CPV2, triggering a pandemic outbreak affecting previously unexposed dogs. And this is the one that concerns us veterinarians these days. When we refer to parvovirus infection in dogs, it is this CPV2 we are talking about. But wait, it doesn't end here. Further genetic drift led to the advent of other variants, CPV2A, CPV2B, and more recently, variants have spread globally. And they may present with different antigenic properties. which can pose a significant challenge for prevention and treatment, actually. Wherever you are around the globe today, canine parvovirus is a threat for our canine patients. And understanding its insidious nature is crucial, I believe, because in order to provide effective care to our patients in our clinics and properly counseling the pet owners we see, this is key as we delve into our discussion today. Remember, our ultimate goal is to equip you with the knowledge and strategies to mitigate the impact of this devastating disease. So we will now embark on a journey during which we will answer 10 questions. 10 very practical questions I believe veterinarians should be very knowledgeable about in order to better address the challenges related to this disease. So let's dive right in and visualize the typical scenario of a canine parvovirus infection. Picture this. A puppy, anywhere from 1 to 6 months old, appears lethargic, loses appetite, and starts to exhibit distressing symptoms such as vomiting and diarrhea. This diarrhea, often hemorrhagic, can lead to severe dehydration, and although fever might be present, it's not a consistent feature here. And I want you to focus on one particular aspect, the smell. You may have heard some of our colleagues mention that this diarrhea smells like death, an almost distinctive and penetrating feature of this type of disorder. Okay, so let's put our understanding to the test. Here, I present to you 3 pictures of diarrhea. On this one, if I ask, could it be parvo? The answer is often a vibrant yes. However, what about this one? Doesn't really look like it, right? And this one? Definitely not, right? I myself would not suspect parvo at first sight if you were showing me those pictures. And yet, all 3 are from confirmed parvo cases. This brings us to our first key takeaway. Parvo is a chameleon, presenting in various guises. The severity and nature of diarrhea can vary from soft to mucoid, bloody or not. The animal's demeanor may also range from mildly lethargic to profoundly depressed. Therefore, anytime a puppy presents with diarrhea, regardless of its manifestation, parvo should be one of your primary differential diagnoses. And by the way, don't be misled by the ominous smell. It denotes severity and necrosis, yes, but it's not definitive for parvo. Even if the smell is present, you will still need to run some diagnostics to confirm it is indeed a parvo case. Because even when dealing with disorders like Giardia and Coccidia infections, which are in nature less severe, you could still end up dealing with the same necrotic smell. Now, consider this next scenario. A lethargic puppy with no overt gastrointestinal symptoms. Could this be parvo? Surprisingly, yes. There exists a myocardial form of canine parvovirus infection. This form, characterized by acute myocarditis, was commonly seen during the initial parvovirus epidemics. But it is currently perceived as a rarity. However, I assure you, it is still encountered. Always remember, parvo should be a suspicion when dealing with a lethargic puppy between 1 and 6 months of age. And now, let's extend our gaze to this adult dog, presented with mild diarrhea. Could this be parvo? Astonishingly, the answer, again, is it could be, yes. Parvo does not discriminate based on age. Subclinical infections, a vital consideration in kennels and animal shelters, can occur even in adults. While these dogs may not fall severely ill, they become virus shedders, potentially spreading the virus to more susceptible dogs. So you see, we've clearly established that parvo takes on many forms and faces. Always suspect it in puppies, and bear it in mind when dealing with adult dogs, especially those dogs living in communities like kennels and shelters. Your suspicion, however, should not be your endpoint. Suspecting parvo is only the beginning of our investigative journey To confirm it, this suspicion must be followed by robust diagnostic tests. Let's journey further into our investigation of the canine parvovirus. Our next checkpoint is understanding the risk factors associated with this disorder. Why is it crucial to comprehend these elements? Because with a grasp of those risk factors, we can craft a better strategy and an effective game plan. Firstly, let's talk about breed predispositions. Certain breeds are known to have a heightened susceptibility to parvovirus. Rottweilers, Doberman Pinschers, and to broaden the spectrum, any black and tan dog seem to fall under this category in my experience. Toy breeds, while not necessarily more susceptible to contracting the disease, often suffer from severe forms due to dehydration's consequences. However, the paramount risk factor stems from the immune status of the dog, and this is not solely dependent on vaccination. The concept of the immunity gap explains why puppies are particularly susceptible, and it revolves around a key player, the mother's colostrum. Colostrum is really like an immunity elixir. It contains immunoglobulins for the disease the mother has encountered or been vaccinated against. And upon birth, puppies ingest the colostrum, and the immunoglobulins it contains are absorbed in the digestive tract within the first 12 to 16 hours, peaking actually at 4 hours after birth. You already see that timing dramatically matters. Now, take a look at this graph and pay attention to those two distinct lines. The first represents the protection threshold, the minimum level of immunoglobulins needed to protect the puppy. The second line represents the vaccine neutralization threshold. Above this level, the maternal antibodies will neutralize the vaccine's antigens. The immunity gap is the period sandwiched between these two lines, typically occurring between 4 and 12 weeks after birth. During this gap, the puppy's antibodies are insufficient for protection, yet abundant enough to neutralize the administered vaccines. This variability can be attributed to factors such as amount and quality of the colostrum, the mother's vaccination status, and this period explains a common phenomenon. The puppies contract parvo shortly after vaccination. And it's not a vaccine failure per se. Instead, the vaccine was administered during this immunity gap, negating the remaining antibodies rather than stimulating the puppy's immune system. This occurrence is known as maternally derived antibody interference. And as veterinarians, it is crucial for us to be cognizant of this phenomenon. It's a key factor in vaccination failures in puppies, often leading to the onset of parvo. However, this challenge isn't insurmountable, and later in our discussion, we will explore the strategies to tackle this issue. Shifting our focus, we know that parvo primarily attacks rapidly dividing cells, especially those in the intestinal crypts, leading to the prevalent gastrointestinal symptoms. And the severity of these symptoms can actually be amplified when parvo is combined with other pathogens. For instance, canine coronavirus, which attacks cells at the top of the intestinal villi, when combined with parvo, can wreak havoc on the digestive epithelium. As you can see here, when the digestive tract of the affected individual is severely messed up. Similar deadly combinations include parvo with circovirus, norovirus, giardia, or coccidia. This highlights a crucial point for us as clinicians. Always be on the lookout for these additional pathogens when diagnosing parvo. Knowledge of such association can inform our prognosis and guide us in designing a more comprehensive treatment plan. For example, protozoa like giardia and coccidia would require specific treatments. So identifying them during the diagnostic process is vital. Remember, parvo comes in many forms and phases and is driven by several risk factors. Knowledge of these risk factors and a good understanding of the immunity gap can be our armor in our fight against parvo. Diagnosing canine parvovirus infection requires an intricate blend of clinical judgment, laboratory testing, and a comprehensive understanding of the disease's typical presentation. And remember what we said earlier, it should always start with a clinical suspicion. So you have this puppy or this adult dog actually in front of you, and you suspect it might be suffering from canine parvovirus infection. You now know that clinical suspicion is not enough, and you need to dig deeper to confirm your suspicion. First step, start with a fecal antigen test. These tests can be performed in-house, are cost-effective, and rapid to implement. Like all diagnostic tests though, be aware that they are not perfect. Although their specificity typically exceeds 90%, we cannot say the same of their sensitivity, which ranges from 16 to 80% depending on the studies that looked into these parameters. And this simply means that false negatives do occur, and they are not rare. They may be due to decreased or intermittent viral shedding in earlier or later stages of the infection, the binding of serum neutralizing antibodies with antigen in the intestinal lumen, or the dilution effect of the diarrhea as well. By the way, be aware that while anecdotal reports indicated that CPV2C infections may occur in the context of negative fecal tests, recent studies have shown that the sensitivity of those tests is not affected by the virus variant, which is a good thing, I guess. In the light of this evidence, in a dog with compatible clinical and clinical pathologic abnormalities, a negative fecal antigen test does not rule out parvo, while a positive fecal antigen test, unless proven otherwise, should be interpreted as reflecting a natural infection. So the fecal antigen test is a good start. But in an ideal scenario, you should not stop there. When possible, I'd always recommend to go one step further. I'd always recommend to look at performing a digestive PCR panel. PCR-based methods, which detect viral DNA, are notably more sensitive and are particularly useful in cases where parvovirus is suspected, but in clinic tests return negative results. PCR assays can even differentiate between parvovariants and discern between vaccine and field viruses. More important in my opinion though, digestive PCR panels can actually help you identify those associations of pathogens we mentioned earlier. And that can help to better define the right therapeutic treatment for a given case. PCR can also be very useful when dealing with cases of acute death. Again, this might not be of great interest for a pet owner, but they become very important if you work with dog breeders or with an animal shelter. In these cases, you want to confirm it was parvo indeed, so that you can take the right prophylactic measures to prevent the potential spread of the disease, necropsy, and collect samples of the different organs, especially the digestive tract and the heart. I will put half of them in formalin and send them for histology, and freeze the other half and send it for a PCR digestive panel. So you see, diagnosing parvo requires a multifaceted approach, blending clinical observation with those two main diagnostic tests. Each step is integral, and when used in combination, provides us with a robust tool set to accurately identify and deal with this severe infection. So, what happens once we encounter a puppy suspected of parvoviruses, presenting with positive fecal antigen test results while we're waiting for the definitive PCR results? The critical next steps focus on a deeper individual evaluation of the case, allowing us to gauge the severity of the disorder and fine-tune the prognosis for the concerned pet owner. One first port of call is to conduct blood tests. The crucial parameter here for me is the white blood cell count that we can obtain through a complete blood count. Leukopenia, a decrease in the number of white blood cells, is a common finding in cases of parvovirus infection. Parvovirus's destructive pathway primarily targets rapidly dividing cells, which unfortunately includes cells in the blood, resulting in a diminished white blood cell count, often falling below 2,000, 3,000 cells per microliter. The degree of leukopenia is widely acknowledged as a prognostic factor. Puppies with a white blood cell count falling below 1,000 cells per microliter generally carry a poor prognosis, and those are considered less likely to survive, to be honest. While this data was previously used almost as a diagnostic tool, its specificity leaves much to be desired. In my opinion, it should serve best as a supplementary source of information to refine your prognosis. For accurate diagnosis, your best allies remain PCR and fecal antigen tests. When feasible, I also recommend a full biochemistry panel to detect any underlying organic disorders. However, if I were to highlight the two most crucial parameters to examine, I would choose blood glucose levels and potassium levels. Hypokalemia, or low potassium levels, is a common issue in parvovirus cases. This deficiency can lead to a myriad of complications, including weakness, illness, and cardiac compromise. Therefore, potassium supplementation is a fundamental step in both maintaining normal kalemia in healthy dogs and restoring potassium levels in hypokalemic cases. The detection of hypokalemia thus warrants the inclusion of potassium supplementation in the treatment regimen. Hypoglycemia, or low blood sugar, may also occur, particularly in toy breeds. This possibility necessitates regular glucose measurements and, when needed, glucose supplementation in maintenance fluids. Hence, when examining a patient suspected of parvoviruses, having data on blood glucose and potassium levels at the beginning of the process is a vital step in establishing an effective treatment plan. In conclusion, you see, while awaiting for PCR results, it's crucial to perform individual case evaluations, including blood tests and, when possible again, a complete biochemistry panel. Pay particular attention to the white blood cell count, blood glucose, and potassium levels. The data gleaned from this test helps to fine-tune the prognosis, provide better care for our patients suffering from this disorder. Treatment for canine parvovirus primarily involves supportive and symptomatic measures to reduce mortality, while specific drugs to counteract canine parvo infection are yet to be identified. A multi-pronged therapeutic approach can help improve patient outcomes. The principal components of treatment include free therapy, antibiotic treatment, antiemetic treatment, and nutritional support. Free therapy plays a pivotal role in the treatment of this infection. And I believe when it comes to this, we can make this very complicated or very simple. At the end of the presentation, I will share with you references if you want to deep dive on this topic, because we could spend just hours on this aspect, I guess. Here, I will give you the very practical approach I used to refer to in clinics, which gave me good results for most of the cases. First, evaluate the degree of dehydration. I'm sure you are familiar with this type of table. Start there and use the data from the complete blood count, like the hematocrit, to be more accurate if you prefer. Then, calculate the amount of fluids the animal needs. You can use this formula here to calculate the volume of perfusion the animal should receive. And here is a tip to quickly evaluate the amount of fluid loss. Roughly estimate the optimal body weight of the pet and compare it to its actual weight. 1 gram of body weight equates to 1 milliliter of fluid loss. So use this to evaluate quickly the volume needed there. 3. Achieve vascular access. Given the high risk of contamination of a catheter with vomit and feces, these days, jugular catheter placement is preferred. It allows not only the administration of IV fluids, but also enables blood sample collection for regular monitoring of glucose, acid base, and electrolyte levels. I must admit that back in the days, I typically go for peripheral vein catheterization, typically on the front legs. If you do so today, be aware that it is recommended that the catheters should be replaced every 72 hours to minimize bacterial colonization. In hypovolemic patients, intraosseous access, like what we do in critical care for neonates, can be considered. They are quicker and equally successful as jugular catheter placement, actually. Must admit I am not a big fan on my hand. The sound it makes when inserting the catheter always makes me cringe, and there are associated risks of osteomyelitis. But to be fair, sometimes this is the only solution we have. So in last resort, do not hesitate to use them. And 4, administer fluids then. An isotonic crystalloid solution, like lactated ringers, is the fluid of choice for initial volume restoration and rehydration. This is typically how it should be used in clinic. As mentioned earlier, if hypokalemia and hypoglycemia were confirmed in the patient, supplement the fluid accordingly to correct these deficits as well. The administration of antiemetics in conjunction with flood therapy and enteral nutrition plays a pivotal role in managing canine parvovirus infection. Research on antiemetic use in puppies with parvo demonstrates that those who did not receive antiemetics had actually an increased length of hospital stay. This finding underscores the importance of integrating antiemetics into the treatment regimen, as this approach could potentially lead to faster recovery times and shorter hospital stays. So you definitely want to make sure you integrate them in your treatment protocol as early as possible. Here are the different antiemetics that are typically described in the veterinary scientific literature these days. Be aware that they do have different modes of action, and maropitant, for instance, seems to be superior in this regard. However, comparative studies have shown no significant difference among these drugs in reducing vomiting episodes in parvo cases. Side note, drugs like metoclopramide can be administered as a bolus or as a concentrate infusion to dogs with severe vomiting, which is something that is worth considering in certain cases, in my opinion. Canine parvovirus enteritis put dogs in translocation due to intestinal villus collapse and the loss of immune function. This translocation can lead to sepsis caused by a variety of bacteria, including Escherichia coli, Salmonella. In response to this risk, the administration of drugs is recommended for all dogs affected by canine parvovirus. And these are the antibiotics that those cases. Ampicillin and cefoxitin as single-agent treatments or in combination with enrofloxacin offer protection against gram-positive, gram-negative, and anaerobic organisms, and are therefore considered rational empirical choices. And as mentioned earlier, comorbidities are often present in puppies with parvo. Therefore, initiation of antiparasite therapy as soon as the puppy can tolerate oral therapies is also something to keep in mind, especially if you confirm that an association of pathogens is present. Enteral nutrition is also a critical component of the treatment regimen for dogs suffering from. It is indeed necessary to prevent enterocyte atrophy and provide the nutrients required for healing. In the past, we used to practice the nil peros feeding strategy in those cases. Do not feed them anything peros for 24 to 48 hours. That's what I was taught back in the day. We know better today. Early provision of enteral nutrition in puppies parvoenteritis has actually been found to decrease patient morbidity and length of hospital stay. Enteral feeding has indeed been associated with improved mucosal integrity, faster repair, and reduced bacterial translocation. So we can calculate the daily energy needs of these puppies. And a nasogastric tube can be used to deliver this nutrition, prevent discomfort and vomiting or regurgitation. We now even have liquid diets that can help, and their use and benefits have been described for parvo cases. So clearly something to consider as soon as possible these days. Canine parvovirus infection often results in significant discomfort for affected dogs. Consequently, experienced by these patients is a crucial aspect of their overall treatment. It is important to understand, however, that not all forms of analgesia are suitable due to the potential for additional complications. Typically, opioid analgesics are used to alleviate pain, but their administration in parvo-infected patients can actually exacerbate symptoms by promoting ileus and vomiting. As such, alternative analgesics like buprenorphine or butorphanol are often preferred over pure mu agonists such as methadone, morphine, hydromorphone, or fentanyl. The incorporation of lidocaine, an anesthetic, at a continuous rate infusion can also promote gastrointestinal motility and provide analgesia. This is also an argument in favor of the use of maropitant, as this antiemetic also provides visceral analgesia. And something to keep in mind, in cases of parvo, it is equally crucial to avoid certain analgesics that can exacerbate the condition. Alpha-2 agonists and non-steroidal anti-inflammatory drugs can cause extreme vasoconstriction and limit gastrointestinal perfusion, while the latter can impair gastrointestinal and renal perfusion, both of which can further complicate the treatment. Certainly more coming in the future in the area of medical treatment. The promise of interferon omega has been demonstrated in reducing clinical signs and mortality, but its high cost and limited availability hamper its regular inclusion in treatment regimens. Early enteral administration of parvo antibodies has shown efficacy in reducing clinical signs in puppies, a key factor in treatment success. Granulocyte colony stimulating factor has been considered for its ability to improve neutrophil counts. Or fecal transplants from a healthy host has shown promising results, including earlier resolution of diarrhea, decreased hospitalization, and improved survival. So you see, there might be change on the horizon, which will give us even more tools, efficient tools moreover, better address those critical situations. Canine parvovirus infection is